Dr. Omkar Warang here, consultant dermatologist, hair transplant surgeon, and the director of trichology at the Hair and Shape Clinic, Mumbai. So my patients come to me and they ask me, do they require a hair transplant? So at the outset, I would like to say that not all hair loss patients require a transplant. First, it all depends upon the type of alopecia, the grade of alopecia, and the evaluation of your scalp by a dermatologist or a plastic surgeon. If the alopecia is scarring or non-scarring, whether the grade is Norwood Hamilton grade 1 to 7 or a Ludwig's grading from 1 to 3. And ultimately, when we evaluate the scalp, only then we determine whether you should go for a conservative management or a hair transplant procedure. Here at the Hair and Shape Clinic, Mumbai, we have a team of a dermatologist and a plastic surgeon to evaluate you, to recommend you an appropriate line of management, be it conservative or a hair transplant procedure. Hair transplant is a journey, and we guide you from the beginning up to the end where you get an ultimate result and you are satisfied. So please get evaluated by a board-certified dermatologist or a plastic surgeon to know the cause of your hair loss and how to treat it. Here at the Hair and Shape Clinic, be well assured that we will guide you through your journey.